This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Farrah Mateen. I'm a neurologist at Massachusetts General Hospital and Harvard Medical School. Today, I'm very pleased to speak with Katrin Seeher. She is a PhD psychologist and a mental health specialist at the Brain Health Unit at the World Health Organization in Geneva. So today, we are here to talk about the American Academy of Neurology's adoption of the statement that, quote, over 1 in 3 people worldwide are living with a neurological condition, based on a recent analysis published in the Lancet Neurology from the Global Burden of Disease Investigators. The World Health Organization, which contributed to the analysis, is also using this new statistic. Previously, the AAN communicated that 1 in 6 people in the United States is living with a neurological condition. So welcome, Katrin.
Hi, thanks for having me.
So it's a real pleasure to talk to you, especially about this really huge statistic that came out of the GBD analysis. So 3.4 billion people live with neurological conditions worldwide. For neurologists who are often very, very busy, that's probably not a surprise to them. But what do you think we can learn from this analysis?
This analysis is the most comprehensive to date, trying to really estimate and quantify the health loss due to conditions that affect the nervous system. And we did this together with our colleagues at the Institute of Health Metrics and Evaluation. So the 3.4 billion people with a neurological condition worldwide together represent the leading cause of DALYs and also the leading cause of years of life lost. So that really emphasizes how big a burden or impact to the healthcare system these conditions are. We also now, through the analysis, know what the biggest contributors of these burdens are. And the top 5 conditions are, for instance, stroke, neonatal encephalopathy, migraine, dementia, and diabetic neuropathy. And by just looking at those top 5 conditions, you see how diverse neurological conditions really are. They span through the life course. They include different etiologies. Some are chronic, others are acute. Some have regional variations in their prevalence. So it really emphasizes and helps us shine a spotlight on what is all needed worldwide to really help prepare our health systems to provide better care for people with neurological conditions.
In terms of DALYs, 1 DALY is a disability adjusted life year, so 1 year of healthy life lost. So importantly in this analysis, I think it's a combination of premature death, like years lost due to death, but also years lost due to disability. And a lot of neurological disorders or conditions are disabling, but they may not be fatal. So I guess this is a very comprehensive look of neurological conditions.
Absolutely, yes.
There were 37 conditions that were finally counted in the analysis. And I think some of them are not seen primarily by neurologists, at least in the United States. And one example would be ADHD. And I'm wondering how conditions were determined to be neurological.
Whether or not certain conditions are traditionally seen by neurologists was actually less critical for us in the decision making or whether to include them in the analysis or not, because this is also hugely dependent on the health system in different countries. So you mentioned the United States, but the situation might be different in other countries. So what we tried with the analysis particularly was that in line with the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, or IGEP for short, which is our global mandate by WHO member states in kind of acting on neurological disorders. We wanted to reflect the life course approach or the life course impact that conditions can have on the nervous system. And so in that view or in that vein, we're included conditions that were previously missing. And that is, for instance, the group of neurodevelopmental conditions that are defined in the ICD-11 because they have a strong link to and an impact on the nervous system. Generally, I think the important message here is we tried to capture all conditions that in any form have either themselves or as their causes an effect on the nervous system.
I was very impressed by the recognition of neonatal conditions, including neonatal encephalopathies. And I spend some of my professional time in Guinea and West Africa, and it wasn't a surprise to me to see neonatal encephalopathies as very prominent in the GBD analysis. But one question I have is, are we really doing enough for neonatal neurological conditions? I feel like they might be neglected on the global policy stage sometimes.
That's true. And again, I think one decision that we took in including or making sure that we're reflecting that full life course spectrum in the analysis was exactly to pinpoint and create awareness for the importance of early childhood in trying to optimize brain health and brain development trajectories. Now, the important part here is also that these early childhood neurological conditions, they disproportionately affect the low and middle income countries. And that, from a public health perspective, offers for us the opportunity for primary prevention. These conditions often can be prevented, and therefore the lifelong disability that would otherwise result can potentially be averted. And similarly, with appropriate support and care services, we can also promote better brain functioning and positive health outcomes, even in individuals that live lifelong those early childhood conditions. And another point of why this is important or creating opportunities is because we can then integrate or mainstream neurological programs in other health programs, such as maternal, newborn, or child health care. And we can also make or advocate for stronger links with the education sector. So all of this, I think, having data, convincing data, helps us to make stronger cases for better services down the line.
When I was looking at the numbers, I felt like it would be easy to become overwhelmed by the extreme numbers of people with neurological conditions, as well as you mentioned, the diversity and range of these conditions. And I thought back to prior work also from the World Health Organization through the Atlas and other documents that said that many, potentially most countries don't have a specific policy for neurological conditions or for neurological patients or even for prevention of them. And even fewer countries have direct budget lines for neurological conditions and even worse, neurological research. My question is, how can the WHO and AN and others work with ministries of health more to begin laying the ground for neurological disorders, budget lines, policies, research programs, etc.?
Our blueprint here really is the mechanism is the adoption of the Intersectoral Global Action Plan, or IGAP. So that provides you with a comprehensive policy framework for 10 years of concerted actions. And the main goal of IGAP is really to reduce stigma or increase awareness and the impact of the burden that we're discussing today, but then at the same time also improving the quality of life of people living with neurological disorders, their carers and families, and decreasing the burden on society. And IGAP outlined key actions across strategic objectives, and I really invite everyone to familiarize themselves with this global policy tool. And we've recently also launched an IGAP implementation toolkit, which is more or less a step-by-step guide on what everyone, basically the different stakeholders, can do in order to make this not just a policy document, but make it a reality. And areas to focus on, for instance, you touched upon it, is improving and strengthening policies and legislation, building capacity in the workforce and improving the access to the services, but then also strengthening data and health information systems so that we basically know what we're dealing with. And closely linked to this is the need for research. So all of this is outlined by IGAP, and together it will help us to move the field forward.
So many countries lack diagnostic tools for neurological conditions. So there are several countries that have never performed a single brain MRI, for example. Do you think these are potentially underestimates from the global burden of disease analysis?
So the lack of diagnostic tools is a big problem from the service delivery or the service provision point of view, because what that does is it contributes to the diagnostic gap. So people who have a condition going undetected and therefore not being able to receive any treatment or form of support. And this lack of diagnostic tools has different reasons or causes. So it could be the lack of resources. You mentioned MRIs. There are many settings where MRIs are not available. It could be the lack of validated tools. So certain screening or diagnostic tools not being validated for the population that we need to use it in, or the lack of training of the workforce in actually administering or using those diagnostic tools. So that highlights one problem. Now, when it comes to the estimates in the GBD, of course, our estimates are only as good as the available data that we can feed into our model. But we do have certain ways to adjust in our models. For instance, if there is, or based on the use for non-standard diagnostic tool in the studies that we're using. And so that would control for the overall underestimation of cases. But again, I think I'd like to use this opportunity to remind us all and to call for more research and better data across the world for all the different conditions, so that going forward, also our modeling and estimation methods improve and become more accurate.
What are the nuances for the WHO's advice, if you will, or recommendations or guidance to higher income versus lower income settings for neurological disorders?
So here I think it's important to remember that most of the nervous system burden occurs in low and middle income countries. And that's where generally healthcare resources are scarce and the access to service is limited. We have a couple of flagship programs at WHO that specifically aim to address those particular issues in low and middle income countries. For instance, we have a program now ensuring on access to essential medicines for neurological conditions. And there's also ongoing work, for example, as part of the Defeating Meningitis Roadmap. But the other important point to remember is that no matter the resource level, I don't think there will be any country that has enough specialists or enough neurologists to really care for all the patients in need of neurological care. So the big take-home message here would also be the need for integration. We need to ensure or build and work towards systems where we can make sure that the broad number or the most people can be taken care of. And mechanisms here would be primary health care, using efforts under so-called universal health coverage, really as a delivery platform, but also in a sense trying to avoid uber specialization, because that might lead to silos and people being seen by one specialist for one condition, but then they might also have other, or we know that neurological conditions are often comorbid with each other. So too over-specialized approach might not necessarily be always the best one. And another point that is very important for us when we think of that life course approach that I've been mentioning a couple of times is ensuring a transition from, if you think, for instance, from pediatric neurological care into adulthood. And often we see that individuals then fall between the cracks. So trying to address this, and this is something that is true for high as well as low resource settings.
I wanted to touch upon any limitations of the global burden of disease analysis. So we know they're estimates ultimately and often modeled, and they're very powerful estimates, but what limitations should neurologists consider?
Yeah. Well, we tried to be as comprehensive as possible to capture the nervous system health loss. This group of 37 conditions that you refer to is still imperfect. There are conditions that are either not reflected in the GBD, despite how comprehensive it is. We're also sometimes not able to dissect or separate the impact on the nervous system from the overall health loss of a condition. And in that case, we could also not include or reflect that impact, that nervous system health loss. And then another limitation, or, as colleagues might be reading the paper, they might think, specific conditions are missing. They may be captured under what is called the residual group of other neurological disorders. And here again, this is due to lack of resources. We were just not able to analyze or model each condition separately. So that leads to this residual group. And another point to remember, I've mentioned it already, is that our models are only as good as the data that we feed in. And due to the scarcity of data in many parts of the world, we do need to make assumptions. So these are the best assumptions based on neighboring countries and most similar countries that we can do. But again, we would need more data, more information from other parts of the world in order to overcome those.
All right. Well, thank you very much. Do you have any final thoughts? I know 3.4 billion is a big number. We often don't hear from people with neurological conditions, maybe because of stigma or ability to advocate for themselves, or even a lack of insight into their own diagnosis. I think it's really important that we have these data, because I think the numbers are probably higher than people would have anticipated. So I'm curious, do you have any final thoughts or parting comments on the analysis?
We intend, and we also invite everyone to use these numbers for advocacy, for awareness raising, because the numbers and data can be very powerful in convincing policymakers and decision makers in taking action, right? We're also going to use this information in our forthcoming baseline report for IGAP to set the scene and paint a picture of the global situation. But then also going forward, we'll rely on these figures to advise countries, our member states, in their service planning. So we're taking into consideration population projections, what might change, what are the risk factors, which conditions are more prevalent or prominent in what regions, and really use that for informed decision making.
Okay, well, it sounds like we'll need more neurologists along the way. So thank you very much for joining today.
Thank you for having me.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.